Hey guys, it's Dr. Kian, and we are live, and we are going to start and get a hold of Dr. Janelle Vega from Miami. As soon as she comes on, we're going to get her and talk about a few different things today. Let's see here. Let me get Dr. Vega here. Got it. She should be on here very shortly. Let's see here. Connecting. There she
Hi,
is.
how are you?
Hey, I'm okay. How are you?
Good. Thanks for getting me out of my pajamas.
I've been wearing my pajamas most of the time, but today I had to do something outdoors, so I decided to wear some real clothes.
Oh, nice.
How have you guys been doing down in Miami, in Florida?
It's okay. It's a
Yeah.
little bit, yeah. People are still going out. It's really scary. They just closed the marinas because they're having like boat parties.
Wow.
So, yeah, it's
Yeah,
bad.
Malibu just issued a urgent alert to get off the beaches because it's a beautiful sunny day and people are
Yeah,
still going to the beach, which is, a little bit nuts right now.
exactly.
So, but hopefully you, your family, your staff, everybody's been healthy and okay.
Yeah, absolutely. Thank you.
Good, good. And I guess, we've already talked about, all of us closing our practices. Won't need to go through that, but I will start and end our interview with just a call to action to all of you out there watching
Hmm.
to close your practices. If you have extra personal protective equipment, contact your local emergency room, your hospitals, and see if they need the extra supplies because, we may eventually all be called to kind
Yeah,
of help with this no matter what our specialties are. So.
yeah, absolutely.
So awesome. Well, let's talk about something uplifting. And,
Okay.
you have been so vocal and amazing on your social media, over the past 1 or 2 years about
Yeah.
what people can do to maintain a very natural, beautiful look that often involves visits to you or to
Hmm.
someone like me. But I wanted to know what you're telling your patients, what you're doing yourself to
Yeah.
maintain your health, not just your overall health, but your skin health and your aesthetics. So while you can't get in to do a laser or an injectable per se.
Well, you know that I also started a company based basically on having people do skincare at home,
Hmm.
and kind of develop a regimen for them. And one of the things that we really talk about, because I do think that skin health and your overall health are connected, is just creating like a mind-body skin connection. And you're doing your skincare twice a day. Why not make that a meaningful time to just like disconnect? And really like think about what you're doing, why you're doing it, and make it useful for yourself and your body. So like most people are really busy. They have 5 minutes in the morning and at night, and now maybe you have a little bit more time. So really just like put down your phone, like think about what you're doing, like give yourself that self-care time,
Mm-hmm.
which I think is really important these days. Like I find myself like checking the stats constantly, like what's going on with coronavirus and being, caught up in the anxiety of what's going on. But
Right.
at the end of the day, like being in quarantine and just being home is kind of an invitation to like connect back to your own self, and kind of like think like, what am I doing here? Just like give yourself a little bit of time, a little bit of self-care.
I
So
love
I do
that. So
think,
meditation in caring for
yeah,
your skin and caring for yourself. That's
yeah,
that's that's phenomenal. I mean, that's such a great idea because we're all so anxious. We're on our phones and we're trying to see
absolutely.
like what's going on in the world. And it's nice to have a release. And if that release
Yeah.
can better your own appearance and aesthetic, that's
Hmm.
fantastic. So
Well,
how do
it
you
will
suggest
just by
like
making you
I do that?
feel. Hmm?
How do you suggest that one does that?
So just when you're, let's say you're gonna go put on your creams, you're not like, I have my TV on, I'm like watching a Netflix show, put the cream on, blah, blah, blah. Like really like set your phone down, like relax, put your creams on and think about what they're doing. They're actually nourishing your skin. You're cleaning off the day. Think about it in a sense of just like cleansing and resetting your skin. And I do believe that beauty sleep is real. I think you need to sleep to be able to allow the creams to absorb. It's really important to wash the day off, wash off the toxins, wash off your makeup. I think now is a great time to go makeup free. We're home, like that's one of the things that a lot of people end up getting clogged pores. having to put makeup on every day. Well, you don't have to, but a lot of people choose to.
Yeah.
So maybe give time where you're going to be makeup free, and that's a great breathing time for your skin. And just commit to yourself that 5 minutes in the morning, 5 minutes at night, let go of everything that's going on, and just, you know, take care of yourself. At Be a Life, which is a company that I founded with Dr. Who, we call it your skincare ritual. And so it's really just like your own personal daily ritual to recenter and to take care of your skin and yourself.
That's awesome. Wow. That's fantastic. I mean, sometimes I'll take a shower in the morning and my mind is so caught up, I won't even remember if I've washed my hair yet or not.
Exactly.
Just like, I'm like, did I wash my hair? I'm like, oh,
Exactly.
screw it. I'll just do it again. So
I know.
that's
It's
not
so
exactly
hard.
meditating. So
I know. And I don't know if you ever use like a meditation app, but there's one called 10%. And now they have like a hand washing meditation,
really?
which is, yeah, because you can make anything a meditation, really,
Yeah.
if you're just, instead of just being focused on other things, just thinking about what you're doing and being present. And that's really where I think like creating that just calmness and
Sure.
relaxation time for yourself, instead of looking at it as something like you have to do, look at it something that you get to do and get to spend time nourishing yourself back for all the things that you're doing, taking care of other people, cooking and cleaning and whatever it is that you're doing, taking care of patients, you know? So I think give yourself that little bit of time, and I think it makes a big difference.
That's awesome. Yeah, what I did yesterday, I did a nice bike workout, like a stationary bike, and
Yeah.
it was fantastic because I just totally got my mind off of everything and just focusing on my heart and breathing and all that. And because, you know, like a lot of us, I've been anxious about everything, you know, about the whole situation, about, you know, the business, yes, but you know, the general anxiety of this public health crisis. So it's been really really challenging times, I know, for all of us. And so it's nice to kind of talk about something, how we can help, and we actually all maybe eventually called to help. Hopefully not. Hopefully we can flatten the curve, as they say, with this whole craziness. So what else are you doing to stay sane and to stay beautiful?
Well, I think one important thing is that people think because you're home, you don't need to wear sunscreen. And so one of the things that I recommend to other people is to always wear sunscreen every single day, no matter what, even if you're home. If you're a person that suffers from melasma, for example, visible light can affect it just as much as UV light. And UV light actually goes through windows. So even though you're home, you don't feel like you're outside, you know, you're not in your usual routine, put sunscreen on in the morning. I find myself going outside a lot of the time. I like to garden. And so I'll just be doing something else, and then I'll just pop outside and go see what's going on, you know, with my plants and my flowers and whatever. And so like I'm outside a lot now.
Right.
And I see people outside. You know, just even driving to the pharmacy today, we saw all these people, no sunscreen, you know, biking, you know, it's sunny. So no quarantining, I call it. It's
quarantining. I like that. So I've heard of the quarantini and not quarantining. So
yeah, exactly.
That's really good. No, that's actually a great point. Like I totally forgot to put my sunscreen on today. I'm bad, and this is natural light that, you know, I'm getting UV light, you know, as we speak. And so you know, we've all seen the funny memes. We're either going to come out really lean or really fat.
Or really tan. So I feel like everyone's going to be super tan like after the quarantine. I don't know why.
So I know none of us can predict the future, but what do you think will have to happen for us to be able to reopen our clinics?
Wow. I don't know. I think there's going to have to be a slowdown in the curve at some point. I think we're still on the steep part of the curve, and that's what worries me. The behaviors of a week ago are now manifesting, you know, and I think a lot of the restrictions haven't been implemented up till now. Florida is not under general quarantine, you know, stay home as you guys are. And so I think it's going to continue to spread for now. I don't foresee myself being able to be open in the next month. I'm thinking, looking at what's happening, especially with a lack of personal protective equipment. I mean, when you're thinking about how viral this is, we use the term viral all the time, but this is very virulent. And if we're not able to be protected, then how are we going to see patients,
Yeah.
And
That's
so I would
really, it's a really important point. I mean, the fact that we don't have the proper personal protective equipment, N95. So, for you with skin, I mean, there's one thing, you could maybe maintain a few feet, but as an ENT facial plastic surgeon, me just doing a head and neck exam on somebody already puts me at much higher risk, or potentially puts them at higher risk if I'm a carrier or have it and don't know. So that's why all of us, or most of us, either have or should we've stopped operating, we've stopped doing, exams in the nose and whatnot. And, it's tough because, both you and I both do some medical practice. I don't think you're 100% cosmetic, or maybe you are. I don't know if you are.
Mostly, yeah.
Mostly, okay.
Yeah,
so that 1%
I'm pretty,
medical.
Yeah, I'm like 95%.
The rash or the issue that people do need medical care,
right?
And so that's been something very, very difficult that we've been grappling with.
Right. So for our office, for example, we're trying to implement a telederm system. So that at least we can see people, because people continue to have skin issues. They may have something that's so itchy it's keeping them up at night.
Right.
They can develop blisters on their body. We do take care for people that are ill, and we have post-surgical patients that we've been following up in the office, taking sutures out for skin cancers and things like that. Exactly. So we do need to be available, and that's the catch-22. I think I would caution against doing cosmetic procedures. Like I'm about even like the last 2 days I was working before, I was wearing a mask, but I was injecting people's lips. I was in their saliva, and I'm thinking like, this is not okay. Like,
exactly.
I don't feel good about this. And so I have to see what happens in the next week or two to be able to really, figure out what's going on. But I feel like this is going to be for the long term, because the personal protective equipment has to go to the sickest people, and to the doctors that are taking care of patients that are in the hospital and intubated. So I don't know.
Exactly. Yeah. Well, I think telemedicine, I mean, everybody's trying to figure out how to do telemedicine, not just in dermatology, but in a lot of different fields. And of course, there's only so much that can be done over telemedicine. But when I can look at somebody, and part of the physical exam is just seeing what somebody looks like, especially in dermatology. Of course, not for as aesthetic types of procedures, but like you said, if you're taking care of someone, post-operative or has a scar issue or post, skin cancer, whatnot. So that's really, really important. So so it's an unprecedented time. It's a crazy time. I'm really proud of key opinion leaders like yourself and a lot of my peers and colleagues that have shut down our doors. And I don't know of anyone personally that is still doing aesthetic treatments or has their clinic open. I've seen some things on the internet, people doing some things. Of course, there's always going to be the bad apples and the bad actors, but as long as all of us have kind of come forth and put this messaging forward, I think it's a really important point. I mean, what we do, I do think is very important for our overall health. I think aesthetics are part of health.
Yes.
And so I don't, I think all of us truly believe that. And so hopefully once all this kind of dies down and settles down, we'll get back to work. And
I think so. And I think it sends a good message that we think it's important to stop, because I think we had even some resistance in rescheduling appointments. People didn't understand, why that doesn't make any sense. Why are you rescheduling me? Like, that's just Botox or whatever.
Right. And
I think it's important that we send a unified message that it is important to stay safe. That's their number one concern. It's not, these things can always wait, that's the thing.
Yeah, I was very interested to know, actually, I was going to ask you that, because we had some patients very irate, and I get it, but I don't. I mean, they've been waiting for weeks to get on the books, or especially for a surgical procedure. They cleared out their schedules. Some were traveling in, and it's been really, really challenging. I've been talking to a lot of I know you have an international practice too, and that people coming to you from all over the world. And so, but everything's canceled from everywhere. So I think now there's more of an understanding than there was last week, because I decided last Sunday to shut everything down.
Right. That was my last.
Surgeries, clinics,
Exactly.
and then we had a trickle of patients on Monday, and then it was done. And so we, we definitely had some resistance and some upset patients, but hopefully now, I mean, we haven't reached out to them since. Hopefully now they would see like we were kind of ahead of the curve for what was going on here.
We also implemented like pre-screening, which now we know doesn't really even work because there are people that are asymptomatic and don't have any fevers and things like that. But just one of our screening tools was, have you been in contact with anyone who's had a fever, flu-like illness, etc.? And again, we had some pushback there. And
we
really,
thought that initially we thought that might be enough too, but we now realize from the data that that's simply not enough unless there's like a 99% sensitive rapid on the spot test. Whether
we
you
don't
have
know.
it or not, which actually might be coming soon. I think there's already a 45-minute test that's been FDA approved, so hopefully that's being manufactured and will be readily available to every clinic, to all clinics around the country. But until then, I think we're all on a little bit of a holding pattern.
100%.
So,
one thing I did want to talk about, which I'm thinking like a lot of people have skin questions about, is the chronic hand washing. Is such a big issue for people that have a tendency towards eczema or dry skin, or just anyone in general who's not used to washing their hands as much and using alcohol-based sanitizers. So if you don't mind, I just wanted to give a couple of tips for people.
Totally.
So there are two different types of moisturizers that you want to think about when treating like dry skin, especially for your hands. So one's a humectant, and that's basically going to give you moisture. And so those are things like ceramides, lipids, things like that are just moisturizing. And then you have occlusive moisturizers that help to hold that in. And so what you can do during the day so you can function, not have like super slippery, oily hands, is use a humectant moisturizer. So I like the one from Ulta MD. The So Silky Hand Cream is really nice. And then at night, use something that's more occlusive. So you can use like a petrolatum base, like a Vaseline or an Aquaphor. And CeraVe Healing Ointment is also really good, but it's super sticky, really sticky. But that's great because you're going to put that on top, and you can even put like cotton gloves on, and then sleep with it. And it just really helps to like heal the skin while you sleep and when you're not moving. Because I don't know about you, but some people get them like on their knuckles, and when they move and do anything with their hands, it re-cracks open. And so just make sure you keep up with the moisturizer. You're going to be very unhappy at the end of quarantine, the state of what your hands feel like and look like. So,
well, this is good news for us guys, because we're a little taboo to have a lot of hand lubricant and moisturizer around everywhere. So, feel free to have tons of hand lubricant, moisturizer, like Dr. Vega said. No social taboos or judgment there.
No, this is not a time for vanity. It's a time for health and worrying about your health, right? Like,
awesome.
For sure.
Awesome. And are you guys doing anything like, so people that want to get like products from your office, are people able to still order like from your office?
We do have online at our office, and then I do virtual consults on BeAlife. So bealife.com. Yeah. So you sign up, we have you send photos, ask you questions about your, day-to-day activities, like where you live, like just very specific. Are you pregnant, breastfeeding, trying to get pregnant, things like that. And then we do create a skincare ritual for you, and then we will actually mail it to you. And then we put stickers on it, this is number 1, this is number 2, morning and night, and to make it just very easy.
Awesome.
So yeah, that's where we really focus on like your skincare ritual. So if anyone wants, I can give you the link. It's bealife.com.
Post the link in your stories after we're done here. And I know for our patients in our practice, we do right now, we're having 20% off all of our skincare products. So for people that are on products and want to continue, we just don't know when we're going to be able to reopen our doors. But it sounds like you've got a really great system there.
Yeah.
So awesome. Well, is there anything else you wanted to bring up while here? Do we have any questions? Let me see if there's any questions that came.
I know I haven't been seeing these.
Let me just see. And what I've been doing is trying to, because a lot of questions will come in afterwards, and then we'll just try to answer them on our own social medias later. So
nice.
Awesome. Yeah. Well, be well. Please send your family my best, and hopefully we'll be seeing you very soon.
Yes, absolutely.
All right, Janelle,
Bye,
take care.
Kian. Take
Bye.
care.